Hi everyone, welcome to week 6 of your Pharmacology 2 course. This week we're going to be covering 2 chapters. The first chapter we're going to be talking about is chapter 19. This chapter covers ear, nose, and throat drugs. And obviously, all of those things kind of are go together because of the sinus cavities and things like that. So that's why we kind of combine it all into one chapter. So the basics that you're going to be looking at here, the basic categories of drugs that are used for the ear, nose, and throat, going to fall into a few different categories. So the first that they're going to talk about is decongestants. And decongestants are basically going to constrict blood vessels to allow you to breathe easier. Is probably the easiest way to describe it. It shrinks the swelling of the mucous membranes so that you can breathe easier. So this might be used in someone who has a cold, the flu, or allergies as well. So a lot of these categories are going to be used for a variety of different conditions, but all for that purpose. In other words, allowing that mucous membranes to shrink. Um, the next category is going to be the antihistamines. Antihistamines are most commonly known for drying you up a little bit. Their therapeutic effect is what they show here, blocking those histamine receptors in the nose and throat. And so they basically are going to reduce that itching. They're going to shrink inflammation. One of those big side effects, though, is drowsiness a lot of times with antihistamines. Benadryl is one of the most common antihistamines, and it actually is used for its side effect of drowsiness for other reasons as well. So not just for its antihistamine properties. Another category that you're going to read about in this chapter is going to be mast cell stabilizer drugs. And these are the ones that are used for things like sneezing, allergies, that type of thing. So you'll typically see this category of drugs used for that. Then we have corticosteroid drugs. They're not a decongestant or antihistamine, so they don't have any of those type of properties. So they're not typically used for like a cold or something like that. You might see them used more along the lines for nasal polyps, as they mention here, other things that allergies, that type of thing. Another category that you're going to find is the antibiotics, which makes sense because if we have something going on like a cold that's caused by a bacterial infection, then we want to treat that with the antibiotics. So those are some of the main categories that you're going to see in this chapter. And then in addition, you're going to see some what we call combination drugs. So they have both decongestant and antihistamine or something like that in them. So that's what's in chapter 19. Now, chapter 20 is going to be all about analgesic drugs. And analgesic drugs are drugs for pain relief. So it can be for mild pain, severe pain, chronic pain, acute pain. So they're going to talk a little bit about what's the differentiators for that. So what's the difference between mild, severe, chronic, and acute? Obviously, depending on what type of pain you've got is going to determine what type of analgesic is going to be most appropriate. And typically, we want to treat the pain with the least amount of pain relief as possible. So it, no side effects would be ideal. Not exactly something that we can always do, but that's what we're going to strive for, is to especially go with the non-narcotics first. That's for mild to moderate pain. And, these are available over the counter. You could be talking about things like acetaminophen or Tylenol. And then when it gets to more severe pain, that's when we're going to get into those narcotic analgesics. And depending on the type of analgesic that you are prescribed, it may be something different if you are in a facility versus if you are going to be sent home. So maybe you're in having a outpatient surgery and they keep you for 23 hours. they're going to give you something different in the facility rather than what you can actually take home with you. So keep that in mind as well. Then we break the analgesics up into categories. The first one that they mention is the salicylate analgesic drugs. So these are the aspirin-based drugs. And of course, there are side effects to the aspirin-based drugs. So you have to make sure that you take those into effect or into account as well. You always want to know what the side effects are. One in particular that you're typically told not to take this is because it can cause it's a blood thinner basically, so it prevents blood clotting. So this is something that you would typically be told not to take if you're going to be having a surgery or something like that, because they wouldn't want any bleeding that they can't control. So the non-salicylic analgesics are things like acetaminophen and Tylenol. So that would be something you could use if you were having a surgery, for example. So those are some of the topics that are going to be covered in that chapter. As you go through this chapter and the previous chapter, if you have any questions about these topics, please make sure that you are reaching out to me, and have a great week.